What's up, party people? I haven't posted any videos for a while. A couple of reasons. I had surgery. I had knee replacement surgery. Let me show you. Yep, this is a beautiful scar. 4 weeks ago, had knee replacement surgery, and it's been a crazy ride. I know you used to see me with the purple hair, so that's probably throwing you off a little bit. There's still some color here. This is what happens when I haven't dyed it for over a month. So yeah, it's been a wild ride. The knee surgery and everything was not at all what I expected it to be. This whole thing has probably been one of the worst experiences I've ever had. And I'm not trying to throw people off of knee replacement surgery or anything like that, but I just kind of want to discuss like what happened for me. Now, if you didn't know, I have arthritis in both of my knees, like really bad, right? And saw a orthopedic surgeon a few months ago, and they said, "Yeah, there's nothing we can do but surgery." And I said, "Okay, let's do it," because I'd heard good things about knee replacement surgery from people online and in person and what have you. So he says, I got to talk to my dermatologist because I was on a certain medication, find out I have to wait 2 months before I have the surgery because I have to get off this medication, okay? So, because it can cause complications. So I get off of the medication for 2 months and I wait. And then when the time's up, I finally, have the surgery. Now, here's the thing about the surgery. I've had surgeries before, and I've been under anesthetics before. I have never experienced in my life waking up from anesthesia and hearing myself scream. Well, calling it scream, I don't know. More like this just loud moaning of pain. That's how I came to consciousness. Loud moaning of pain. And from there, it just became this, this nightmare for me for about a week and a half, maybe 2 weeks, where it not only was just a lot of pain, where they only gave me like Tylenol 3 with codeine to deal with it, because that's what they said, that's what they had to give me for whatever reason. Tylenol 3 with codeine. And if it wasn't for the fact that I had my own like supply from years ago of Norco, I would have gone crazy that first week with the pain. And then it also starts affecting my mental health because I felt like I had been violated somehow. I don't know how to explain it. I felt like my body was screaming in anger. I felt like I went through a traumatic event. That's the only way I can explain it. And see, the funny thing is, I've heard other people talk about this, and they don't talk about how how traumatic it was for them, or how often they cried in that first week because they were stuck in this bedroom and their mental health was just deteriorating because they felt like, I felt like I was a burden on everybody around me. And here I was, going through the suffering, and it was just crazy. It was just crazy. And it was just this horrible, horrible, just like, let's put it like this. There came a point where I said to my girlfriend, if I had known this was going to feel like this, I would have chosen to just not have the surgery and just be in a wheelchair. And if I couldn't walk, I couldn't walk anymore. That's how it affected me. That's how hardcore it affected me. Was just that the pain, the depression that hit. So, I suffer from depression, and I've had a pretty good handle on it for the last 10 years, thanks to therapy and meditation and what have you. Wow. It hit me hard. Hard. Was not expecting that at all. Threw me for a loop. But by the end of the third week, I had decided that, you know what, I know what I need to do. I need to take better control. I need to start being more proactive in my mental health. And so I did. I knew what I needed to do. I started meditating again. And that helped quite a bit, a lot. Like getting on an old bicycle, because I hadn't meditated for probably a year or so. And, that's the thing is, you feel like you're getting better and you stop doing the things that helped you feel better. And you can go on cruise control for a while, but when something happens, you're not prepared for it because you haven't been doing the things you know you need to be doing. You know? So yeah. So that I'm on week 4 now. I've had a good week where I felt, more myself, and I felt more, how do I say it, like positive. Now the doctor said he wants to look into doing the other knee in 3 months. I told him, try 6 months. We'll talk about it. But honestly, at this point, I don't know if I'll ever get it done again. I mean, it was that traumatic of an experience for me. It was that just emotionally, physically traumatic of experience for me. I don't know. Or if I did, I might have to go with another doctor. I mean, I don't think my doctor is bad or anything, but I don't know. I just don't want to go through that experience again, that hell that I went through. I just don't. If it comes down to it and I have to go into a wheelchair because I can't walk, or they're the worst things in life, right? I just don't want that experience again. And who knows? I might change my mind in 6 months. Who knows? The doctor says it's like having a baby. You hate it after it happens, and you say you'll never do it again, but, you forget. So, I don't know. Who knows? But, like, right now, I've gone downstairs. I live in a condo. I've gone downstairs to the living room about 4 or 5 times. The last time I did, I kind of pushed myself too far, and I hurt my knee, and it became tender, so I stayed upstairs. I want to try to go downstairs next week. This coming week. And hopefully, get out of the bedroom more and get back to live streaming, things like that. I need stuff to focus on and move forward. Because right now I'm just like, I'm sitting in my bedroom and watching TV, TikToks, stuff like that. That's where I'm talking to you from right now, is my bedroom. And it's time to start getting in gear. Anyway, sorry for this long ass video. I'll edit it down. But I just wanted to share with you guys what was going on with me, and let you know things will start getting back to normal somewhat. We'll see how it goes. Anyway, yeah, thanks for hanging out, and see you soon.